Hello, everyone. My name is Louise Chawla, and I'm very glad to have this chance to talk with you and look forward to sharing with you afterwards. I'm an environmental psychologist who also have a background in developmental psychology. So my field of research is how to create the most healthy, supportive environments for children and adolescents, including connecting with nature. Children, however, live with adults, and their well-being depends to a large degree on the well-being of the adults around them. And therefore, I've been going in and out of the research on benefits of access to nature for both children and adults for many years, actually since the 1980s, when the field was barely beginning. And so I'm going to start with a very quick overview of that field's history. The first study, controlled study that looked at people's access to nature, either as green views or being out in nature, and its impact on their health and their subjective sense of well-being, came out in 1979. And then there were a couple more studies in the 1980s. So we get a total of 3 studies from what I or anyone else I've seen can count for this very beginning of this field of research. And the most cited study from this period came from Roger Ulrich, where he's founded Pennsylvania Hospital, where some patients recovering from gallbladder surgery happen to have a grove of trees outside their windows, and others happen to have a brick wall. And he looked at their recovery rates. Those who happened to have the trees outside their window went home from the hospital a day earlier, almost a full day earlier, needed less pain medication, less nurses' attention, and it was effectively random assignment. They did not choose their rooms. They went into whatever room happened to be open. In 1990s, the number grows to maybe around 20 studies, significantly more, but still a small number. And most of these studies came from a team of William Sullivan, Francis Kuo, who worked in South Chicago in public housing developments, looking for naturalistic experiments like this, where some people in public housing happen to have scuffed grass and asphalt around their buildings, and others happen to have trees. And I think what's striking about this is not lush nature. We're talking about ecosystems. This is not a lush natural ecosystem. And yet they found significant differences on a number of important measures in terms of better health and well-being for people who lived in the lower levels and happened to have trees outside their windows. Again, effectively random assignment. People were on waiting lists to get an affordable housing unit, and they took whatever came up. With the beginning of this millennium, this field of research looking in very systematic, controlled ways on how access to nature benefits people's health, it begins to just rise very rapidly, continues to no end in sight. And one of the signs that a field of study is emerging is it has its own textbook. We now have that. There are many books for designers, architects, landscape architects on how do you apply this research in creating places for people, integrating nature into the places where people live and work and study. And there are a number of popular books now to bring this research to a popular audience. And here again are examples of just a few. In 2013, the American Public Health Association responded by creating a policy statement advocating that public health professionals they apply this research So policy statement on improving health and wellness through access to nature. I co-authored this with a colleague at the University of Colorado, Jill Litt. So that was a very quick overview of this growing field of study. So when I say going in and out of it, keeping up with it is a very approximate term because it is such a large and active field of study now. People already have to specialize in the area that they're working on and following closely. I want to go back even further in history now and relate this to ecosystem services. The idea that going out into the countryside is good for people, that it brings peace and a centeredness, is very old in Western culture. We can see it in the literature of classical Greece and Rome, and the idea of the pastoral. We see it again in Romanticism and Transcendentalism, like this painting by George Inness here. And we can see similar ideas in other cultures in East Asia or South Asia, for example. So it's a very old idea. And of course, what is new is making it a topic of systematic study. Frederick Law Olmsted, in the late 1800s, the founder of landscape architecture in our country, he believed in this idea very strongly, and he called it a charm. So he writes repeatedly about charming natural scenery, and he said it is a charm in that we do not know how it works. And yet he believes strongly that it does benefit people's health and well-being, and therefore he wanted to bring it to the masses of people. To him, it was an important part of a democracy that all people should have access to nature, regardless of their income. And therefore, he and his firm worked across this country, creating our great early urban park systems, and then other landscape firms were doing this as well. So at this time, when Frederick Law Olmsted is working, we have the beginning of the idea of conservation, which is coined under Teddy Roosevelt by Gifford Pinchot's circle. And this idea that we need to protect natural resources scientifically for their continued exploitation by industry. So thinking about what basic raw materials for industry and for human needs. And that's coexisting with the transcendentalist, romantic movements, the democratic activism of Frederick Law Olmsted to bring nature to everybody. So we have these two groups, and they're not sitting at the same tables. The scientists are not inviting John Muir and the Romantics to the table with them. And so we have these different ways of looking at the value of ecosystems, the resources it protects for industry. And yes, the idea was that people can go out into the forests and for recreation too, but the goal is to preserve these resources for ongoing industrial development. And then this valuing it for these more psychological, even spiritual benefits that people get, the restoration, sense of vitality that people get by being out in nature. And they're very, they're disconnected at this point in history. By the late 18th century, and of course you all are more experts on this than I am, but we have the recognition that, there are lots of other services that natural areas provide for us, these regulating and maintenance services that people were not paying attention to before. And now there's the drive to actually quantify them and put dollar signs on them so they can be valued as much as those natural resources for industry. Millennium Ecosystem Assessment, as its reports come out at the beginning of this millennium. So we now add a new category of ecosystem services, cultural services, but it's very small. It appears in to a very limited degree in the reports being issued at this time, but it is recognized. And notice it's opening the door for those romantic ideas and voices to come back in again. The idea that societies can draw spiritual values and aesthetic values, and as well as recreation from natural areas. And going back now to the brief history I showed you of the development of systematic research on nature and human health, that, as I said, was really beginning to take off around the year 2000. And it's not noticed yet by the Millennium Ecosystem Assessment reports. It's not in there. But as that research grows and grows, it's necessary to notice it, to figure out how to accommodate it. I would love to talk with some of you later, but my understanding is that this research is being stuffed under cultural services, which is really inaccurate. Here, just in terms of physical health, is a list of some of the major areas of research finding benefits for people when they have nature around their homes or their workplaces, their schools, outside their windows, or they actually go out in nature. And a nice review done coming from the ecosystem services side by Paul Sandifer and others that has a long list of the benefits that are being identified. So it's recognized now in discussions of ecosystem services. These are not cultural services because many different measures are being used, including biomarker measures that show that regardless of the country or the culture people are in, if they move from a built environment into, say, a forest or a park, their biomarkers of their stress levels, their EEG, brain waves, their heart rates, immediately quickly show better health, less stress, more relaxation. So this is part of how we are built as human beings. It's not about our culture. And then psychological and cognitive services, major area of benefit. And again, I've listed some of the kind of major areas being studied now, all with many studies to the effect of that these services are found again and again in terms of better attention and focusing, reduce stress, and just doing better psychologically and feeling better subjectively. So all of these ecosystem services are still following the model of conservation described by Gifford Pinchot, where it's about what are the resources out there that we can take. What is our ecosystems, natural areas doing for us as individuals and as social groups? And this research that I've been showing you is most of it is guided by a medical model or even a medication model. People have a physical or a psychological problem, and a dose of nature helps them improve. So then the question is, of course, what dose is needed? And what is the economic value of the health services it provides? And these are two very active current areas of research. So nature is, in effect, a green pill for us to take by having it around us, going out into it. So just there, as I say, what dose is needed is a very active area of research, a number of studies, but one that much cited now that came out last year with a large a sample of residents in the UK compared people who said they spent no time in nature during the last week with others who spent different amounts of time. And they found that the cutoff for significant health benefits was only like between 2 to 3 hours. People who reported being out in nature 2 to 3 hours during the week showed significant gains on multiple measures, and these gains were equivalent to the benefits that research shows people gain when they move from an area of low economic deprivation to from an area of high economic deprivation to low deprivation. If they move up from a area of low SES occupation to a high level job, and if they move from being sedentary to meeting physical activity guidelines. So these are major effects. And yes, this is very much a social justice issue. Minorities, African American, Hispanic, Asian, are about twice as likely as whites to live in blocks like this in this picture, with no trees and at least half the ground covered by surfaces like asphalt and concrete. And people who live below the poverty line, regardless of their color, are also significantly more likely to live in barren areas. We also know from a great deal of research that although people of color, low-income people may have parks in their neighborhoods, they're much less likely to have large, well-maintained, safe parks with good amenities than white people or people with higher incomes. And so another big area of research right now is how do we provide nature? How do we green these barren environments without making them so attractive that we jumpstart gentrification and these families of color and low-income families are pushed out of where they live into even more difficult conditions? So this is a big area of research right now too. Another shift we see in the research is it's beginning to look at quality more and not just quantity. And what it shows is that all green is not the same. A lot of the research has used aerial photographs that actually kind of counts the green pixels around people's homes or schools or workplaces. Now there's more attention to let's go down to the ground level and what people actually see and what they have there to interact with. And an area where a lot of this focus on quality is happening is with biodiversity. So biodiversity is one of the measures of quality, and there's a lot of attention to it. And what it shows is that people appreciate biodiversity. This is not true in all of the studies. People are not even have a subjective sense of biodiversity and feel better in parks and outdoor spaces that has more biodiversity. That's not invariably true in this research, but it is usually true, and it's trending that way. That more recent studies are showing that more and more. And even though people do not measure biodiversity the way an ecologist does, there's a rough correspondence between the places they perceive to be more biodiverse and expert assessments, and people are looking for variety in noticeable species like birds and trees and flowering plants. And when they do believe there's more biodiversity there, or when the ecologist is measuring it and then looking at how they feel about where they are, people report a greater aesthetic appreciation of where they are, greater subjective sense of well-being and happiness. They more likely to report they're in good health, and they report a sense of restoration. And they also prefer areas with more species richness, or more likely to report identifying with places like that, feeling more connected to nature in species-rich places, more likely to invest volunteer hours working to clean up or improve, restore biodiverse places. And when they live in more biodiverse areas and general neighborhoods, they're more likely to report satisfaction with where they live. So these measures, feeling identification with your place and connection to nature and being willing to volunteer hours taking care of the green spaces around you, they're beginning to point to a big missing piece in our conceptualization of ecosystem services. And I would love to hear from you later about how many of you are familiar with this idea of relational values. It starts out in environmental ethics a few years ago, but it's really picked up and comes on stage with a paper written by Kai Chan and many colleagues on why protect nature, rethinking values and the environment. And they point out that all of this thinking about ecosystem services is that model of what do people get from nature, whether it's lumber for their housing or it's health. And relational values accommodates the way people actually talk about how nature around them is important for them, which has been left out of the ecosystem services conversation up to this point. And it's about not just what are people getting from nature around them, but how are they valuing, what's the quality of the relationship they report having with nature. And we find that that value depends a lot on whether they are caring for it. So it's relational values are mutually beneficial to natural areas, to ecosystems, and to individuals in them. And with this paper, Kai Chan and others were saying in environmental ethics, going way, way back, we have this argument, should we protect nature because of its intrinsic value, independent of people, or should we be protecting it because of its instrumental values? And all of that work on, since time Gifford Pinchot, and of course even way before that, just in popular thinking about natural resources, has that's on that instrumental value side. But here are lists of some relational values, both for groups of people in society and for individuals. And again, that identification with the place, that caring for the land is fulfilling for me. It makes me feel good. It's part of living a good life and living up to my sense of responsibility to care for all life, both as individuals and as groups. So let's add relational values now to the health benefits of ecosystems and access to nature. And of course, the basic health value, provisioning services, regulating and maintenance services, they are of course contributing to our health too, our basic survival. And then all of those other cultural services, physical health services, psychological and cognitive services. Let's talk about relational values too and begin to measure them. And I've listed different kinds of relational values where there is research going on. There's quite a lot of research related to environmental identity, but the largest area of research related to relational values has to do with connection with nature. And that's where I've been working the past 2 years, and I'm going to focus on that. And what it shows is whether you are measuring connection to nature, or you're doing qualitative interviews with adults or children, or observing children at play, for example, whether it's quantitative or qualitative research, people who show more connection with nature, who report feeling more connected to nature, it does have benefits for them. It's associated with more personal growth and actually both with adults and children, more creative thinking, more pro-social behavior. All those experiences out in nature, intrinsically positive benefits, of course, fewer psychological complaints. People are more likely, both children and adults, to self-report. They have good health, they're feeling good. It's part of living meaningfully, feeling connected with nature. So there are still benefits for people of all ages when they feel more connected to nature. And what this research also shows is that people who feel connected to nature, children or adults, are much more likely to be doing things to take care of the natural world, to be involved in conservation behaviors. So again, good for people, good for the ecosystems around them. But I'm just going to close on this one note. As the biosphere unravels, there is a problematic as well as a positive side to feeling connected to nature. And this is a very new area of research. I see there's a lot of work actually paying attention to the psychological impacts on people done with adults. So papers coming out from the American Psychological Association in our country and other countries as well. But in terms of actually measuring impacts of feeling connected to nature and levels of worry about it, and people get information about climate change and biodiversity loss. I've seen those studies with children and adolescents, mostly middle school, high school students. And since the 1990s, studies that are showing that young people, when they're asked to just talk about their hopes and fears for the future or their environmental concerns in a general way, they reveal high levels of alarm about the environment. They're often very much concerned with what's happening to animal species, the loss of biodiversity of habitats for animals. But for growing numbers of people now, all ages, they're actually seeing this. And these are photographs just from my county. Our 2013 devastating floods, very destructive floods. And then this past summer and fall, sky was orange around here a lot of the time, ashes falling from the sky. Here in Colorado, just as in California and the Northwest, in more wildfires and much hotter, more ferocious wildfires. So people are seeing these changes too. And my last slide. So a really new direction for the health and nature research, and really this is just emerging, is how recognizing that connection to nature also means connecting to a nature at risk, and that can involve difficult emotions as well as all of those positive well-being benefits. How do we help people face the changes underway and still create, conceive, maintain a sense of constructive hope that there are things they can do as individuals and working together collectively to protect the natural world rather than their falling into denial and despair, because we know from research that is a very real option. So really just emerging direction of research. And I will stop there. That is the end of my presentation, and I'm happy to take questions.